So what are we seeing here? We're seeing improved compliance with home exercise program. Um, there was really not a way, thinking about 10 years ago when I'm practicing, I've been working, I've had 2, 3 clinic sessions with Jimmy. Maybe there's 5, 6, 7 days in between the next session. He comes back and I say, how you doing with those, the workout at home or the stretches at home? And is it helping? Is it hurting? It's not helping. Nothing's helping. What did you try? Did you do them? Yeah. And in the back of your mind, you're thinking, okay, did you wake up this morning knowing that you had an appointment, not do anything this week? Wake up, oh, I got an appointment with Matt, do a couple exercises so that you could say that you did them, right? Like now we're seeing that they're happening. So me as a professional, if I saw that Jimmy, dude, he logged in 6 out of the last 7 days. He even told me how difficult they were. He even has his sets and reps listed. Boy, this guy went far. I know that he did them. He said that they're not helping. Okay, what we need to check some things out, right? So that's the intention behind that 7.5 code, that 7.7 code of using that software in that way. And so the patient that gets it, I don't know how many times I've had it, just kind of getting feedback from patients after the fact. They're like, yeah, after I got over the fact that it was one more thing to do, like it helped, Matt. It did. Like it did. I was doing my stuff more often and that was beneficial to me. So I appreciate it. If you got that person that comes to terms and is able to verbalize it. Um, the patient that has better communication will demonstrate better outcomes if they felt heard and taken care of. And this is a way to be reimbursed for that part of your care. And then, of course, hey, pipe up. Let me know if you got questions. Schedule a quick call with me. We'll do something like that. Let's make sure it happens. So patients like it. Therapy side, the therapist in clinic side. Yes, it's improving the HEP adherence. So that person that is being diligent, you can usually progress them more. We kind of knew that before we could see it on a graph. But now we can see it on a graph and we can tell people that this is included with your care and an expectation of you. Let's do it. Now we're getting more people to really truly follow through on what we're asking to do them at home. That's improving the outcomes. It can allow for flexibility in scheduling. If you're just slammed and there is somebody that really doesn't need to come to you 2 times a week, let's do more of a management schedule, Sally, and let's get that new eval in. Guess what? We've got RTM. We're you can message me, we'll call, we'll figure out a way to communicate, however that looks in your clinic space. She's being managed and still having a couple codes to bill for while you're getting that new eval in, right? So it's helping clinics out that way. Um, we can progress the patients more quickly rather than just watching them do their exercises. Okay, review, move on, kind of thing, right? The obvious one that we're all intrigued in is the money, right? Is the juice worth the squeeze? If done well, yes, it is. And if we take these other things into consideration, it certainly is. Um, you know, we talk about perfect patient population. Where does this fit in? The way we describe the 7.5, the tracking your exercises, you can still get those codes through on somebody that you're seeing 2 to 3 times a week. That's how we start. We're going to establish a habit. Great, right? Let's do your work. I'm going to follow up with you. It's quick. It's verbal reminders to make sure that they're doing their work. We talk about somebody in the Parkinson's world where now we moved into a management progression. Even in my outpatient world where I know that healing doesn't happen in 6 weeks, you're not going to be better. We're training out of habits over your last decade that got you to this point, right? So we need to rewind the tape for a while. In my optimal world that I can sell a patient on, here's what PT really is. Yes, we're going to do 2 times a week for the first 4 to 6 weeks, but now I'm going to drop you off and I'm going to keep you accountable and hopefully end up in some kind of management progression, which is where your Parkinson's patients live. It's never going to go away. We need to elongate this, right? Either we're limited by insurance, your ability to come in that frequently, your work at home is really what makes the difference. Let's move you into a community of people doing this stuff, but still check base with me once or twice a month. That's your ongoing plan of care that that is needs to be stayed engaged with. I've never seen a patient population nor the caregiver more invested than this type of people do. And you know what I'm talking about. So they like this. They like being able to sign in, say that they're doing their exercise, ask you a question or two, follow up with you here or there kind of thing. It's really, honestly, if I had to choose a perfect population that fits well with an RTM scenario for an outpatient clinic, that'd be it. I hope I've made that clear so that you can kind of see where that fits in. A quick little phone call, a little touch up here, and staying on top of progression so that they're not losing steps in between the visits. Also, they're generally reimbursed by some form of insurance that falls directly under CMS. And that is who we know since day one had to reimburse these codes, right? So this is the best studied and standard, just like everything else out there when it comes to billing and reimbursements, is your Medicare patients. Okay, so we kind of baseline from Medicare, and then we know what commercials pay for things and what third-party insurances pay for things. So these numbers here are pretty much the first number listed is what I'm seeing when I bill these codes for Medicare. Medicare with a secondary is the second number, right? So they're going to pick up the other change. What my experience has been as that RTM champion, to kind of define that a little further, my buddy owns a few clinics in Oregon, 13 PTs. My current life situation at the time allowed me to invest my time to really dig in and figure out what this looks like, both from a compliance standpoint legally within the rulings, but then also how does this happen on ground level in the clinic. So I built a program for him and called myself the RTM champion. So I do, on behalf of the PTs, the tracking, the billing, the communication, so that their day is not screwed up. All they got to do is tell the patient this is going to happen and send them their program, enroll them. Now I kind of take over from there. So I've got a good handle on what numbers are coming in, at least in Oregon, where there's a little change regionally and even by state. But this is what we're seeing. So if we just take 2 months with an active patient, and I am able to bill each code on that person for a month's time, right? So I've got 2 months to work with. These are the numbers that we're looking at, right? So if I bill 7.5, 7.7, 8.0, and 8.1 in that first month, that first 30 days, magically that person enrolled with me on the first of the month, right? So this is the easiest to kind of keep numbers straight. Then we go, all right, I can end up with $210 extra, not really modifying my plan of care in time with that patient in the clinic. That's a good base to go from. The way I see it is that call, that communication, I'll usually end up with an 8.0 with patients. More often than not, the way I set it up is the extra stuff that's needed, I'll be able to bill an 8.1 with those patients.